today's session was one of the sessions which we realized that while we have done about 400 dedicated health media workshops. Today we are into our 8th National Convention of Health Writers. In this journey, I remember Dr. Shashank Joshi has been associated with us for more than 15 years, sir, when we started, and he's been an integral part of this journey. So what we realized that there are certain aspects which come as sort of a very important issues while the health media is evolving. While this health media, we have touched base with more than 1,000 health media across the country in last 15 years, and we have on the health media demand, we have kept various dedicated workshops for them. Like one of them has been on interpreting international studies, data interpretation. Yesterday we did a very interesting session of how to use AI for health writing. AI is a friend or foe. So one of the things which came up, and we have taken this as a session separately and requested the prominent experts who are available to address these issues, as the healthcare industry media interface, and how can we foster meaningful dialogue. So this dialogue between the healthcare industry, the healthcare professionals, top doctors of the country, the key opinion leaders, the industry solvers, this has, of course, this whole health writing is evolved around this. So in health writing also there are two parts of it when it comes to writing in healthcare. One is the business writing, whom we call pharma and healthcare industry correspondents. Like we have Vishwanath Pilla from Economic Times Mumbai. He is a very dedicated pharma healthcare industry editor. So other is, which is a larger chunk which we have been working with for so many years, is the health journalist who report on health issues, diseases, technology, the challenges, the lot of data which come around in terms of the gaps, the new evolution of any treatment module. So these are also, and they are that's what we are, as I told you, we have dealt with almost 1,000 such health writers, and we have been part of this journey, evolution of this journey. So what we realized that can we have some view from the experts that how, while we move forward in this, you saw so many social media, digital influencers, while this era is also parallelly evolving now, and they are also taking a lot of space, how can we move forward in making this more meaningful? So as I will start with, I have with me my co-moderator, Mr. Manish Rastogi ji. He is also an industry expert, particularly in the medical devices sector. And I will first like to definitely start with Mr. Deepak Sahni, founder and CEO of Healthians. Healthians is, I think, comparatively a very new story. It may be 5 years old? 9 years old now, but we have been seeing and hearing more about it in last 4-5 years, and that means that you have done, from where you started and where you are today, you have done quite well. And so Healthians is one of the fast growing health tech startups in India. Could you please tell us more about your company, its vision and mission and achievements? And my second question would be, the preventive health is often neglected or overlooked by many people who only seek medical attention when they fall sick. What do you think is the role of preventive health in ensuring people stay healthy and avoid chronic disease? And how has the media been supporting or hindering this cause? Supporting as well as hindering this cause, both.
I think just to tell you about Healthians, it started back in 2015. Now India's largest health test at home service in almost 210 cities with 3,000 odd people, and with its own labs at the back end. How we are different is because we started industry's first few things, which is direct to consumer diagnostic brand of India, which is technology backed. We don't have any brick and mortar center, we only service at home. So we don't call people patients, we just go at patients' home and do the tests. It's entirely technology backed, so we've been hearing a lot of technology things in the last presentation as well. So back in 2015, we also disrupted the space by saying there can be a control that has to be shifted towards the patient, and he has to have a control of getting a test done, plus also getting the reports, getting the analytics on the reports, getting the entire you can say historical record, and taking a control of the entire thing from a preventive health point of view. Now the start of this happened because I spent 19 years in healthcare, largely on the curative side, like medical travel, hospitals, building hospitals, running hospitals and stuff. And I realized it's all been treated, right? And there is no prevention happening in there. And whatever best you done, everybody who's coming out of the hospital says, "Hey Bhagwan, hospital ki shakal mein dikhana." That's what the feeling is. But what do we want to do about it? So we realized that people does not know because the statistics were very different. So 70% of healthcare spent is done by lifestyle disease patient. We are losing 73 lakh people every year just because some lifestyle and chronic diseases. It is costing us 7 years of income if a chronic disease gets untreated. So there is a startling facts that are coming out that probably if we control on the lifestyle disease, we'll be able to save a lot of people. So I just tell how our journey happened with our visions that we started in. When I started, my vision was only simple things, saving people landing into hospitals. That was the vision I started with because I saw so many people landing into hospitals that time. When I started that journey, I realized that a lot of people think that they will never land into hospitals. So that is why they are not choosing healthcare or a preventive healthcare. Within 3 years of doing this, we realized that people want to live more. And this chronic disease is actually taking away 10 years life expectancy from people. And let's build that. So we changed our vision to adding 10 healthy years to every Indian's life by actually doing prevention. Now post-COVID era, people have even changed because the life is changing. People have more acceptance. People have more awareness. And now we say that our vision is to make every day healthier, right? Because it's no more like I want to live healthier after 50, after 60, after 70. And with all that you're hearing here, people are now just saying that I want to be a better version of myself the next day. So it has now become like how can be I healthier every day, and the choices that we do every day is actually about all being healthier. So that's how the journey started. And today the service is obviously pan-India, and it's going and expanding internationally also. And we position ourselves as number 4th player in the entire diagnostic space and number 1 player in the online diagnostic space with all the best accreditations and all. Last week we've been ranked number 1 diagnostic company in Delhi NCR. So that's how been our journey. About preventive health, when you talk about, I think we are from day one promoting preventive health and a lot of awareness. And it took a lot of time in 2014-15 convincing somebody to take a preventive health checkup was very difficult because usually when we did a survey, about 67% people said that I will only get a test done when I am symptomatic. So there is no prevention, right? And that is how they used to be, and they don't want to get to a doctor or a hospital just for the purpose of getting a preventive check done. So we changed the whole industry, bringing a lot of technology, artificial intelligence and everything to help him find out without getting a test done if he's at a risk. So that at least he knows I'm at a risk and I can actually now take a test. So that test started coming in. But then the problem came in that how do I choose my test? So we brought in the first time a right kind of a price point for people to say there can be a whole body checkup, right? And the whole body checkup or a full body checkup term came then. Largely for people to understand that, okay, if you don't know what to be done, at least once in a year you can have these tests done. And a lot of awareness started from there. And then we created a lot of tests based on your age, gender, symptoms. We had tests that if you are a drinker, we had a test. If you are a smoker, we had a test. If you wear high heels, we have a test. We have every habit test out there for people to understand that what can affect your life if you are having something as a symptom. And we have immense number of case studies of people being detected first time through us. We still say there are 7-8% diabetics in the country, and there are still 7-8% who does not know they're diabetic in the country, right? And that's how the preventive health has to work on. And specifically, I see there is always a help from the media. There is no hindrance, but still the promotion is just 10% of what it could be. The awareness drive is has to be at least accelerated 8x, 9x. In India, we are just talking about 2 things. I think we started with polio and then to TB, and then we end there, right? For us, the prevention is only these 2 diseases. But what's killing us and what will kill us in terms of cost, money and everything to the country is also going to be largely the chronic disease, which we are not targeting at because it's been actually rampant, right? So there is a lot of data which is now supporting these particular things that we have actually got catched off people early in the age of 27, 28, and they've been able to reverse their disease at that point of time versus actually getting into chronic disease. And unfortunately, all these chronic diseases are like that. If I have started to become a pre-diabetic or maybe I have an hypertension at 27, 28. By the time I get to know I'm already 35, right? Because it starts to show the symptom there, and then I get myself tested. So we have seen immense cost being saved when people are doing preventive tests. So I think the support of media is there, but then it is just 10%. It has to accelerate at 9x from here. Thank you.
So while you point to the lot of attention going on, say starting from polio to now tuberculosis, so does that also mean that the government is more inclined towards these diseases which are widely prevalent than putting any resources or focus on preventive health?
Yeah, so I think from a government point of view, we talk about preventive health. You only get 5,000 rupees income tax saving today, and that's the only thing that it talks about preventive health, where everybody is just talking about, can I have a bill so that I can save my income tax rather than getting a test done, right? So and it doesn't has anything other than that when it comes to preventive health, and that's why they think that it is rampant, that we have to actually rededicate polio and all, because it affects largely. So I'm not saying that doesn't has to be impacted, but NCDs is something where the awareness is very, very less.
So when we talk of preventive health, how can we forget about Dr. Mohsin Wali? Sir is a Padma Shri awardee and a doctor to 3 presidents of India, and one of the very few into this preventive cardiology. So when you talk of cardiologists, you always think of, or you always come across interventional cardiologists, but Dr. Saab has held the baton of preventive cardiology for many decades, more than 3 decades, and still at this age he runs a very, very active practice in Gangaram Hospital, and also his very popular clinic in GK2. And so you have also been getting a lot of queries on multiple issues, I see, from all the TV channels, from the media connecting you for course, for taking your opinion. So what has been your experience, Dr. Wali, and how do you think we can improve on at least the preventive health aspect, whether it is cardiovascular diseases or overall NCD or any other preventable diseases, sir?
India is now a country of young people, and young people have their problems which are different from people of my age and people of old age. This is one. Second, young people are curious. Third, they are encountering new problems. Fourth, they are not following the rituals of older people in the family. They are having their own life, their own style. That is what we medically call lifestyle. It is not a style actually, it's a paradox of that. There is no style in it. The style was in the past, in the era of Charaka and Shrutala and Munis. So we have distorted health actually. So the role of you people as a health media is to correct that distortion. Treatment is our job. There is a distorted perspective in the health sector, or the health of the population, or the health of the individuals. Previously we were talking about radiation, Hiroshima, Nagasaki, chromosomal changes, generation of cancers. These were the topics the media was discussing. Post-bomb scenario, mutations, then came mutations like words. Now this is a total distortion. This word just came to my mind while after seeing the presentation enriched by Dr. Shashank Joshi, because everyone in this 140 crore population is a unique creation of the God, which we mythologically believe, and for this unique creation of God, there cannot be a dictum 1, 2, 3, 4 do it. So everything which we as a doctors and you as a journalist have to do has to be tailor-made. I'm talking something philosophical, but this is truth and would remain truth tomorrow. What you were listening from these 3 young ladies, what their approaches to life, this was not talked 30 years back. Last night I was in a dinner after I left your program. A young journalist who reports media came to me and showed his video. I walk, after that I run. How much exercise should I do? So these kind of questions are in the mind of young generation, which needs to be addressed. Number two, health for all was long back 2020 में WHO का स्लोगन आया था हेल्थ फॉर ऑल. अभी तक हेल्थ फॉर ऑल नहीं हुआ है. टू, I am complimenting you. Initially, I complimented you because health is a subject which is a never-ending subject. You can keep on writing. Three, there is a great responsibility of media to address all the issues, health-related issues, and health, as Healthians did not point out, on their reports they are suggesting health tips also. He did not mention that. And I appreciated that when I went through it. So when the patient wants to see something, he wants to see the solution also. For that, he is in a problem to choose doctors. So he resorts to internet, Google. These days, all the patients are well informed before they come to me. And I really face a challenge to talk to them because I must not talk anything wrong to them. I must not talk anything which they know already. I must talk to them something new which they don't know, like you just saw in this program. So this is whole body digital twin. So what is happening these days, media has got a great role to educate the people, debunk myths, promote behavioral change, highlight public health issues. Now public health issues, as you said, are changing. Previously it was TB, polio. Now it is post-COVID disease. Everyone, I challenge all of you sitting in the, let me be less harsh, I can say with confidence, all of you sitting in this were previously remembering your phone numbers, which now you see in your phone book. Previously you were remembering your number. I still remember my hostel's number, 60420. This was something which was working beyond what we see. Now, I asked my son to calculate 63 into 2. He will open the phone, then he will open the calculator. This is what is a change. There is a change in the air. Just like you say on Valentine's, love is in the air. There is some change in the air. And now, since the change is in the air, it is a global phenomena. Since the change in the air, it is global phenomena. Now it is a global responsibility of the biggest institution, that is media, health media. And health media needs to do a lot of homework. You don't just go and click a picture, farmers agitation, 3 bullets fired, publish it. No. When you write an article on dermatomyositis, which were the most recent articles you have read, on that famous girl which acted in Dangal, Amir Khan's film. So you have to read about dermatomyositis. You have to know what questions to ask from the doctor to make up your writing. And then you have to choose words very carefully. In today's Hindustan Times magazine, I came across one small correction. The journalist was very thorough and she wrote the article and she writes, it's a rare autoimmune disease because this girl succumbed to death. She writes, she succumbed to it due to medical complications. Correct. Weakened immunity. Correct. Aggravated by steroid use. This is totally wrong. This is not correct. Because this journalist might not have been told by the doctors who gave interview to this young girl that steroids are the treatment of choice. How can there be overuse or misuse? So these are the minor things which the health media and people associated with health media have to study. Rest all you can know. I'm just pointing out something interesting, that we have some rare diseases. Our teachers, Shashank sir, used to teach us that very important line I'm telling you, which is good for media and everything, please. Common diseases should be taught first when we see a patient. You see, same applies to media also. That's why I'm telling this, Chairman. rarer manifestations of common diseases are commoner than rarer diseases themselves. This is what applies to health media also. The more you repeat on common diseases, more will be of the knowledge to the common people. And second is the health media has infinite powers through various platforms, through the telephone-based platforms, through AI-based platforms now, through the classical newspapers, radio, and grateful to people like Shashank Joshi, Narula ji, and everybody who has collected here for a good cause. And this is what we are talking is future of tomorrow. Future of tomorrow, not less important.
I come to my friend Dr. Mr. Harbinder Narula, CEO of Business World Healthcare and Wellbeing, and his very fascinating journey from starting his career from Google to come into as a into health journalism, health videos, to now leading a very popular journal, Business World, the healthcare and the well-being division. Harbinder ji, you said that you have a perspective, so why don't we start with that?
See, I'll tell you what, I used to work at Google, and one of the things that was my core was I was leading the content partnerships and content development. And one of the reasons I moved on from Google was when I was accessing some reports on what was happening in the healthcare field. Whenever you would go and search for anything, they would have hundreds of search result pages that would come in. But could you take that information and use it and apply it in your real life? Probably not. And that is when 2008 I moved into healthcare content. Now fast forward to 2024 where we are sitting today. If you look at healthcare content, where are we accessing it? Probably Google. How are we accessing it? I don't think anyone of us, unless we are related to healthcare profession, are reading long articles. We are watching videos, we are consuming infographics, etc. Now what that creates is, there's a clutter of content coming from all sources. What it makes us want to do is to, one, focus on how the content is going to be shared so that the essence of it is understood by the people who are consuming this content. So when we talk about AI today, patient or general user is not concerned about AI or how it works, but he is intrigued to understand how predictability will help me understand what my body better, and that leads to prevention. That is what is of interest to them. So can we make information usable? That's the first thing. Second is like what Dr. Mohsin Wali said, that we have a lot of responsibility when it comes to healthcare journalism. We have to ensure that the information is going out in a manner that it is correct and can be useful, but does not create confusion in the minds of a patient today. Who's using the content? Patient or a patient's family. When they consume the content, what is the most common content which healthcare journalists are putting? What are the symptoms? How can it be diagnosed? I mean, if you start going through the symptoms without responsibly putting it there, every person is a heart patient, everybody is diabetic, everybody is leading towards cancer. When they go to a doctor, the biggest challenge that doctors are facing today is that, people are coming with a lot of fear, scare. They may not be having anything, but they assume that they are unwell, and they are, in fact, rather than asking the doctor what is happening with them, they are suggesting that, doctor, is this what I have? And they're using terms which is, even for a healthcare journalist, is very difficult to even pronounce. So I think there's a lot of clutter in the space. There's a lot of responsibility that needs to be there when anybody is writing anything. The second aspect, Sudeep, what I would want to mention is, there are two aspects of journalism. One is a B2B and one is B2C. B2C is where there's a lot of care that needs to be there, because it's the general user who otherwise has no information or understanding of healthcare beyond knowing the symptoms, right? So that is where there's a lot of care that needs to be taken care of. When it comes to business journalism, the audience is completely different. Then we are talking of the healthcare industry and the ecosystem, which is a different ball game altogether. That's my perspective.
So I like to have the last perspective from none other than Dr. Shashank Joshi. I feel he has been one of the leading medical influencer of the country. I have known him for more than 2 decades. Padma Shri Dr. Joshi. Sir, you have been an eminent public health expert, both a medical educationist and a public health educator. So what is your take on the quality and quantity of health information that the media is providing to the public? Are they covering the topics that they most relevant and useful for them? And any additional perspective?
I agree with Harinder. You have been doing the B2B and education of healthcare journalists, and that's something laudable, and I've known you for more than 2 decades now. And I think we are in best of times, as Charles Dickens said, but worst of times. Because I agree with Harinder that there is a information overload and digital toxicity. And we all need a digital detox at least every day for 1 hour. That's the first thing. When you get up in the morning, don't see your WhatsApp. There is a WhatsApp University which gives information, and YouTube, and then you work for Google, but Google search. So there is a Dr. Google. And unfortunately, my friends in the audience like Anupam ji, Pritam ji, or Rajesh ji have to have a challenge. They are medical doctors. We stand for medicine and science. So the information in the space which is either phygital, which is physical as a newspaper or a magazine, or in the media space is not evidence based or peer reviewed necessarily always. And if it is peer reviewed and published in a journal, and we have some global experts here in this audience, then it is not interpreted appropriately. And I agree with Professor Mohsin Walia. I have known for almost again 2 or 3 decades. He's like a big supporter of lifestyle medicine, and I saw those wonderful young ladies who are game changers today. They are the influencers of the world. But when you interpret healthcare information, the first thing is it needs a filter, and it needs some degree of regulation, and it has to be correct, and it has to be vetted. So that's the lacuna which I see, and therefore there has to be some degree of oversight. Second is that we are clamored by non-communicable diseases which are essentially coming from lifestyle. We are not eating on time. We run on Indian stretchable time like we are doing this meeting now, and I think we have overeaten into somebody else's time, but we started late. Okay. And then we eat very fast, we don't eat on time, we are always not doing adequate physical activity, we have become very sedentary, and then you don't sleep appropriately, and then we are always on a screen. So that has led to a boom of lifestyle diseases which don't get a clamor which Sani ji was alluding to, and unfortunately tuberculosis and polio still because communicable diseases have that. But I think one thing happened in COVID. I must thank all healthcare journalists and put your hands together for everyone here, because whether it's doctors, healthcare journalists, you all did a fantastic job in education and dissemination of the right information. And I think that's one time when public and private and government and non-governmental agencies all came under one roof to fight a common enemy, which was the disease, and we are through in the post-pandemic time. And I agree with Dr. Mohsin Walia that we still see a post-COVID syndrome. If you can't remember names like, I had to ask Maluk, person sitting next to him is so familiar, but his name is Dhananjay, because I had probably long COVID, so my B12 was not appropriate. Okay, so Dhananjay, sorry for that. Okay, but having said that, we need to be very mindful of in the current times that healthcare journalists are the true influencers of creating a public opinion. And it's important that it's vetted, it is correct, and it is science driven, because we are doctors of science and medicine, and the evidence base comes through randomized control trials, meta-analysis of those trials. So there's a lot of science which goes into it. So I think it's important that it gets the right vetting. Secondly, somebody made a claim of cure. Cure is a very dangerous word. Okay, but promotion of right health habits, inculcating them is the way to be there. So I think I again congratulate all of you all. I know that I don't want to exceed my time. I think the media plays the central role today in influencing decisions for everybody, whether it's the housewife through an Instagram video she sees, on a healthy cooking platform, or a young kid who wants to decide which gym to join and what supplement to take. And that is where the healthcare journalists need to filter and say this is correct, this is evidence based, and this is the right kind of information. And again, the onus is also on doctors and associations to ensure that the right kind of public fact sheets are out in public domain.
Long time back, Dr. K.K. Agarwal, late Dr. K.K. Agarwal, he said like Coke and Pepsi, they reached rural hinterland. So I'm just asking, would this be a possibility
Home
with
testing.
with health tech companies?
I think it is going there. It is, see, ultimately, when we talk about accessibility, actual accessibility is taking it nearer to the patient. So, earlier the expansion in India for healthcare has happened that you reach near to the patient, but the lab is still far away, right? Expectation is changing completely because every doctor in a small town that we meet, he says, "Can you give me a report in 2 hours?" Right? And I will give a sample to somebody who can give me report in 2 hours. Which means the lab has to go near to the patient rather than just having a logistic network. And we know there are labs in country which basically collects from all over the country and take it to one city, right? Versus what the patient demands. So I think the turnaround time is the thing. And now at least with the new machines and new manufacturers coming in, we have those sort of machineries where a small lab setup can be done, maybe as small as probably 500 square feet, right? Which can actually take up to a lab very near to the patient. So I think that's definitely is becoming a possibility where it will go to rural India for sure.
Thank you so much. I could see the convergence of physical as well as the digital logistics.
Yeah.
Thank you.
Thank you.